ただいまご到着です。皆様ご起立の上、拍手でお迎えください。それではただいまよりハイレベルパネル岐路に立つ世界の感染症対策を開始いたします。はじめに主催者を代表し、日本国際交流センター理事長渋沢よりご挨拶申し上げます。
キクウェテタンザニア連合共和国大統領、森喜朗元内閣総理大臣、パネリストの皆様、そしてご列席の皆様、本日は TICAD 公式サイドイベント、岐路に立つ世界の感染症対策に皆様をお迎えすることができまして、大変光栄に存じております。主催者を代表して、ここより御礼を申し上げます。さて皆様、ご承知のとおり、森首相が議長を務められた2000年の九州沖縄サミットで感染症対策へのコミットメントが発表されました。以来、これまでの13年間、国際社会は感染症対策で多くの実績を積み上げることができました。感染症の脅威を劇的に緩和させるよういうことができました。その成果は特にアフリカでは顕著でございます。今回の TICAD では成長が著しくアフリカに日本がどのように関わっていくか、我々は答えを出さなければいけないと思います。感染症対策へのコミットメントは人道支援としての意義に加え、アフリカ経済社会の成長にとり不可欠な人々の健康に対する長期投資ということに確信しております。本日のハイレベルの我が国のパネルでは、我が国の厳しい財政状況の中で、この大切な投資の規模、そして成果を高めることに多くに期待しております。それでは早速ですけれども、開会に起こりまして、森元内閣総理大臣より一言ご挨拶をお願いいたします。お願いします。
ご紹介いただきました森喜朗です。開会の前にですね、今、渋沢さんからご挨拶がありましたが、この運動といいましょうか、この感染症対策に対して、最もご苦労されておられたのが、渋沢さんの前任者であります。山本さんであります。去年のちょうど1年ほど前になりますか、本当に残念でありましたが、他界をされました。山本さんは、国際交流センターを率いておられまして、日本と各諸外国とのずっと戦後からの関係をですね、外務省にむしろ代わって、その中間のお仕事をされてましたし、私も国会議員も43年もやりましたが、長い国会議員生活の中で、私ども政治家とアメリカをはじめ各国とのいろんな方々との調整、そういうプログラムを率先して作っておられた今日、国際国家日本としての大きな成長ができました。その支えてくださった、いやむしろそれを先頭に立ってやっていただいたのは小林さんでございました。心から私どもは感謝をして、どうでしょう皆さん、皆さんとお立ちいただいて山本さんに黙祷を捧げたいと思うんですが、ご賛同いただけますでしょうか。外国の方々もお見えでございますが、日本式でやります。 黙祷。ありがとうございました。後でまたご挨拶があるかと思いますが、相澤先生、一郎先生、私、本当にですね、我々自民党の議員団も、もちろん野党他党の皆さんもそうでしたが、山本さんにお世話にならなかった人はないぐらい、立派な指導者でありました。私はたまたま沖縄サミットでこの感染症の問題を国際社会全体で取り上げていこうという提案をいたしました。しかし実質的にこれをずっと進めてきてファウンドを作り、そして多くの国々と交渉されたり、日本の政府を督促させたり、いろんなことは山本さんがほとんどご自分でやっておられたというふうに思って、本当に亡くなられる時は私も愕然といたしました。亡くなられる直前、お見舞いに行った時ももう退院できるんだと言って嬉しそうな顔をしておられましたけども、私はこの退院はひょっとしたらという感じを持ちました。その後しばらくしてからお亡くなりになったという連絡が来ました時、一番心配したのは、そこにおられる伊藤さんたちに申し訳ないが、交流センターのことよりもこのエイズ基金はどうなるのかなと実は一番心配をいたしました。しかし幸い渋沢さんがこの会を引き受けて、この山本さんの仕事を続けていただけることになったということで安心をいたしまして、昨年私は国会を辞める決意をいたしました。43年勤めておりましたけれども、私の後というのも、私がやってる間中ずっと私を支えてくれたのは相澤先生でありました。このアフリカの問題もですね、本当に私が政治家としてこのアフリカ問題にずっと一生懸命自分の大事な仕事としてやってこれたのも、実を言うとアフリカの、今は54カ国でありますがに対して全ての国々と連絡を取って議員活動、議員交流、議員外交というものをやってくれたのも実は相澤さんであります。この私のやっておりました AU アフリカユニオンの議員連盟というのもですね、今回私が辞めまして相澤さんにお譲りをいたしました。本当はこのご挨拶は私じゃなくて相澤さんがいいと思って辞退をしとったんですけれども、ちょうどこちらへずっと3日間私も来ておりましたので、皆さんにご挨拶だけさせていただきたいというふうに思います。最初に申し上げなきゃいけませんが、Jakaya、Mrisho、キクエテ、タンザニア連合共和国大統領、たくさんのご日程の間を縫ってですね、こうしてご出席をいただきましたことを本当に心からお礼を申し上げたいと思います。そして、マグダイブル世界基金事務局長、こうしてわざわざ、おいでいただいています。そして渋沢さん、そして多くの皆様、日曜日でありますのにおいでくださいました。お礼を申し上げます。私は、格別思い入れを有しておりました感染症対策に関するこのシンポジウムの開催にあたりまして、少しお話をさせていただきます。大変光栄であります。TICAD の20年のこの歩みを振り返りますと、アフリカの援助を語る場合から経済成長を共に語る場合と変わってきております。いわゆる安倍さんの昨日のお話の中にも、もう助けるとか助けられるんじゃなくてウィンウィンの関係なんだよということを強調しておられました。まさにアフリカと日本は協力しながらアフリカの開発、平和、安定と同時に世界へ貢献する2つのチームという、そういう考え方で進んでいかなきゃならんと思います。しかしそのアフリカの発展というものを考える上でいくつかの問題があるわけでありますが、その中でやはり感染症対策というのは 切り離せない課題であります。私が感染症対策に取り組むようになりましたのは、13年前の G8 九州沖縄サミットに遡ります。この時、沖縄のサミットの課題は3つございました。その第一が感染症対策、2つ目が IT 革命で、3つ目が経済の発展という、この3つのテーマを九州沖縄サミットで我々は世界の首脳たちと取り組んだんです。最初、この感染症対策を一番に挙げてこられたときに、かなりいろんな国からなぜなんだとか、いろんな疑問もございました。しかし、世界にどんどん蔓延していくこのエイズ、さらに我々の日本の国では少し忘れられたかもしれない結核の問題、そしてアフリカでは最もやはり生活基盤というものをきちんとして差し上げなければならん、そのことが原因となるマラリア対策、これらはですね、やっぱり発展した国々が、成長した国々がやっぱりお互いに協力し合って、そしてこうした国々に援助していく、お手伝いをしていくというのは、これはまさに政治問題なんだと、そう私は皆様に呼びかけて議論をしたわけであります。当時、約年間500万人以上の人たちが命を落としておられました。国際社会として一致した取り組みをしなければならん、それも急いでやらなきゃならんという、そういう危機感が高まっておりました。そういう中で、G8 サミットで、初めて主要テーマとして取り上げました。国際機関や市民社会を含む革新的なパートナーシップを構築することを合意をいたしました。以来、2002年に世界基金の設立を得ました。この沖縄サミットを受けまして、すぐちょうど2000年のミレニアムサミット、国連での総会がございました。そこに参りまして、私は日本政府代表として、この感染症の問題を国連の場でお話をいたしました。当時の阿南事務総長も大変共鳴をしてくださいました。そしてぜひこの世界基金を作ろうと、そのためのいくつかの柱を立てようという、その協議をする場を作るということで、そして、前の国連難民高等弁務官をおやりになっておられた女子、尾形さん、最近後期高齢者になったらすぐ名前忘れるようになっちゃいました。尾形さんにお願いをして、阿南総長も尾形さんが議長ならみんな協力するよということで、そしてこの世界基金の構想をですね、国連の諮問委員会の中でお作りをいただいたのが最初のスタートでございました。今、この基金ができましてから、三大感染症対策は大きく進展をいたしました。拡大する一方でございました感染症の流行が、世界基金が支援する事業によって転換期を迎えていると申し上げていいかと思います。予防治療の普及により、エイズの蔓延はピークを超えました。マラリアも蚊帳や治療薬が飛躍的に普及しました。結核はミレニアム開発目標を達成する目前になっております。3つの感染症を合わせた年間の死亡者も2000年と比べてみますと約200万人減少をいたしております。日本はこの国際的な努力を世界基金のドナーとして、また現場で連携するパートナーとして支えてきました。世界基金の資金で予防治療活動を展開する際に鍵となる人づくりにつきましては、日本はアフリカとアジアを中心に地道な息の長い支援をしてきました。これは日本自身が第二次世界大戦から復興期に人材育成によって結核を克服したというこの経験と強みに基づくものでございます。また政府だけではなくて 熱意ある日本の企業の皆様方にも取り組んでいただきました。そして大きな成果を上げることができました。住友化学のオリセットネットは、タンザニアの合弁企業に生産技術を無償提供することで、マラリア予防のみならず、現地の雇用創出にも貢献してまいりました。結核やエイズの分野で日本企業の技術を生かした治療薬やワクチンの開発が進んでいることも誠に頼もしい限りであります。私は日本がこのように官民挙げて感染症対策を重視してきたことを誇りに思っております。安倍総理が先月発表いたしました国際保健外交戦略では、ユニバーサルヘルスカバレッジに向けた包括的な保健システム作りを中心に据えました。アフリカの感染症対策をさらに一歩進める上で、こうした包括的な取り組みはますます重要になってくると思います。我々は多くを成し遂げてきましたが、世界では今なお年間300万人以上が三大感染症で亡くなっておられます。これらの疾病を克服するには、さらなる努力が必要であると思います。今日はアフリカから卓越した指導者、キクウェテタンザニア大統領もご列席をいただいております。この後ご登壇をいただきまして、大統領と今日ここにお集まりの皆さんとともに知見と共有し、今後のより良い取り組みにつながることを期待します。今回のTICAD 5、日本に一番最初に来られて、一番最初に安倍総理と首脳会談をなさったのはキクウェテ大統領でありました。日本との関係も極めて深く、また私も個人的に大変親しくさせていただいておりますが、これからますますアフリカのこうした感染症に対するリーダー役としてご活躍を心から願って、歓迎の拍手でお迎えをしたいと思います。ありがとうございました。
Your Excellency, Mr. Mori, former Prime Minister of Japan, Excellencies, invited guests, ladies and gentlemen. Well, I thank the organizers for associating me with this high-level panel on a matter that is very close to my heart, but also on a matter of critical importance to the survival of humanity. For many years, infectious diseases have been a major cause of suffering and death to mankind. Due to advances in medical research, medicines to cure and prevent these diseases have been developed, and a number of infectious diseases have been eradicated in the process, and the threat of the remaining ones has been and continue to be reduced at varying degrees of success. Unfortunately, due to lack of financial resources, lack of adequate skilled human capital, and appropriate technology, countries of Africa and other developing countries could not take full advantage of the advances in medicine. Consequently, many people in Africa have died and continue to die of diseases which can be prevented, diseases which can be cured. To date, 3 infectious diseases pose a big challenge to humanity. These are malaria, HIV, AIDS, and tuberculosis. These account for more than half of all deaths caused by diseases in the world. Currently, they are the biggest health threat to human survival. Together, the three diseases cause illness to over 300 million people and over 5 million deaths each year. Unfortunately, and for the same reasons mentioned earlier, Africa and sub-Saharan Africa in particular is severely affected. More people suffer and die of these diseases in Africa than in any other continent on this planet. The solution lies in Africa overcoming the inadequacies, financial, technological, technical, and human capital. It is heartwarming to note that in the past 2 decades, tremendous progress has been made in the fight against HIV/AIDS, tuberculosis, and malaria in Africa. In the 1980s, very few of us would have believed such progress could be possible. In the case of HIV/AIDS, for example, in the year 2000, just over 50,000 people were receiving ARVs therapy in sub-Saharan Africa. By 2011, the number was 6 million people. Just over a decade ago, TB case detection rate was 43%, and the treatment success rate was 67% among the 22 countries with highest TB burden in Africa. By 2011, case detection rates rose to 66%, and the treatment success rate was 87%. In sub-Saharan Africa, fewer than 5% of households owned insecticide-treated nets in 2000. By 2010, that number had increased to 53%, with hundreds of millions of more nets distributed since then. In Tanzania, to date, 91% of households have at least one insecticide-treated bed net. 75% of the population have access to insecticide-treated bed nets. 68% of the population sleep under the insecticide-treated bed net. 75% of pregnant women sleep under the bed nets. 72% of children under 5 sleep under bed nets. Mortality trends from these diseases provide further evidence of the dramatic progress being registered against them. Between 2005 and 2011, AIDS-related mortality decreased by 24%. TB mortality rate declined by 41% between 1990 and 2011. As for malaria, the global mortality rate is estimated to have decreased by 26% between the year 2000 and 2010. During this period, in Africa, more than half of the deaths averted were in 10 countries which had the highest malaria burden in the year 2000. These efforts have saved nearly 750,000 children across 34 malaria endemic countries over the past 10 years. Even more appealing is the fact that 85% of these lives were saved in the past 5 years alone, the period when funding intensified ninefold. Ladies and gentlemen, these remarkable achievements are very much a function of substantial increase in resources allocated by governments in Africa and development partners, including bilaterals, multilaterals, also private foundations, persons of goodwill, and non-government organizations. These funds were used in medical research, training of health personnel, and rolling out new technologies, medicines, vaccines, and other facilities and services. The establishment of several global health initiatives around the turn of the millennium made a huge positive impact in the fight against AIDS, tuberculosis, and malaria pandemics. I have in mind institutions like the Global Fund to fight HIV/AIDS, malaria and tuberculosis, Roll Back Malaria, the Global Alliance for Vaccine and Immunization, GAVI, and other similar organizations and institutions. I would therefore like to take this opportunity to express my heartfelt gratitude to these organizations, as well to governments, private foundations, and persons of goodwill who support them. I'm convinced that without their generous and extensive support, we would not have reached the turning point we are celebrating today. All of us now are optimistic. In the 1980s, we did not have the faces of optimism as we do today. Nonetheless, the road ahead is still long, and there is every reason to assume that it could be bumpy. A quick assessment, for example, indicates that while TB mortality has decreased significantly, multi-drug resistant TB remains a critical global threat. Furthermore, in spite of the impressive global reductions in malaria deaths and cases, such progress remains fragile. In countries where coverage of insecticide-treated bed nets has not been maintained, and nets have not been replaced in good time, there has already been reports of resurgence of malaria cases. Also, there are rumors, or maybe confirmed reports, of detection of resistance to ACT by malaria parasites in some countries of Asia. If this is true, the information is both disturbing and worrisome. Ladies and gentlemen, we know that disease control programs must be sustained and should continue to be advanced in order to consolidate the gains and make further achievements in reducing infections. If we are forced to cut on disease control efforts, there will certainly be a resurgence of infections. We may find it too difficult to put things back on track again, and control will be challenging. It could result in costs which could be avoided. It is incumbent upon us as African leaders to reaffirm our commitment to continue to increase budgetary allocations in the fight against the infectious diseases. If that were to prove difficult, at least we should maintain current levels of financial allocations. Also, increased support by Africa's development partners is critical in order to maintain the momentum attained so far and scale up interventions to further reverse the scourge of HIV, AIDS, malaria, and TB. It's imperative, therefore, that all stakeholders sustain their efforts and maintain the momentum in the fight against infectious diseases in the world, in Africa in particular. I'm happy to note in this regard that this high-level panel will discuss a number of specific issues with a view of carrying forward the global health agenda. Let me state clearly that infectious diseases and economic growth in Africa are related. The reduction in the burden of diseases will have direct positive impact on increased productivity. You don't need a professorial lecture to know that a healthy population is more productive than the one that is heavily exposed to debilitating infections. AIDS, tuberculosis, malaria, and other infectious diseases are leading causes of suffering and early death in Africa. They deprive our societies and nations of precious human capital for development and survival. Besides, prevention and treatment of these diseases present a heavy burden on the budgets of African governments. Experience has shown that success in the fight against infectious diseases is very much a function of interrelated political, financial, and technical factors. It's an open secret that strong leadership from all levels of the political hierarchy is necessary for any disease control program to succeed. Here, I have in mind, with the case of Africa, from the national level to the village and community levels. We in Tanzania have experienced this firsthand, that better health outcomes happen in districts where political leaders are actively involved in immunization programs and in the fight against HIV, AIDS, malaria, TB, and other infectious diseases. We have learned also that without substantial financial support to national disease control programs, it would not have been possible, or it would not be possible to achieve the results we are bragging about today. Many African countries are contributing considerable own resources in health programs, but without support from the global community, we would not have recorded the progress made to date. As alluded to earlier, besides contributions from traditional bilateral and multilateral donors, global initiatives like the Global Fund, Roll Back Malaria, and Gavi have been instrumental in the successes we are recording today. They have invested significant resources in supporting national programs to roll back infectious diseases. The investment they have made is paying returns. Ladies and gentlemen, in my own country, Tanzania, for example, the Global Fund has been instrumental. So far, over the last 10 years, the support has been close to $1.2 billion. This has helped in a big way the successes that Tanzania has recorded. We are now witnessing reduction in HIV prevalence from 11% in 1999 to 5% 2012. We have increased TB case detection rates from 51% in 2008 to 76% in 2012. Reduced malaria prevalence in children by 50% since 2008. And under 5 mortality rate reduced from 147 to 81 per 1,000 live births in 2010. As we express our gratitude to Global Fund, I would like to use this opportunity to appeal to all parties concerned to continue to support the Global Fund, particularly now during the replenishment of the fund's resources. Let me also ensure, let's all of us ensure that the fund is replenished substantively, and we hope Japan will lead the way in this endeavor. As you have always been one of the biggest supporters of the fund. Ladies and gentlemen, the other thing we have learned is that successful disease control programs are based on good research and sound technical advice. Research is essential, not only biochemical research, but also social and behavioral research that could help develop effective tools to roll out cost-effective preventive and curative programs in entire nations. The technical assistance provided in dialogue with our partners, and sometimes our partners sending experts to our countries, has assisted us in a big way to upgrade our own skills and take advantage of the lessons learned in other parts of the world. With regard to building synergy between disease-specific programs and the rest of the health system, I believe getting priorities right has always been very essential, very beneficial. In Tanzania, for example, we have designed our disease control programs with a special focus on primary health care. At the same time, we have been strengthening our general health information systems, expanding medicine distribution systems, and increasing the capacity of our health training facilities. Again, we thank the Global Fund for providing invaluable support through the national disease control programs for AIDS, malaria, and TB, and other specific health diseases, health systems strengthening programs in this regard. Finally, let me underscore the importance of ownership by African governments of the various programs and projects supported by the international community. My observation is simple. Country ownership is key. It has worked well in many countries, including Tanzania. Fortunately, there is a global consensus about this matter since the Monterey Consensus in the year 2002. I would be pleased if this long-standing common understanding would underpin our discussions today. I look forward while looking forward to fruitful and productive discussions on how we can move forward and free the world from preventable and curable diseases which cause unnecessary sufferings and death to millions of people in Africa and this planet. I wish this high-level panel successful deliberations. Thank you.
ありがとうございました。ここでキクエテ大統領と森元総理がご退席になります。皆様拍手でお送りください。
レイアウトを変更いたしますのでしばらくお待ちください。それではただいまよりパネルディスカッションに移りたいと思います。モデレーターのロリー・ギャレットさんにここからは司会のことをお渡しいたしたいと思います。ギャレットさんお願いいたします。
こんにちは。Konnichiwa. I'm Lori Garrett from the Council on Foreign Relations. It's indeed eerie to be in this building, having been here in 1994 when the International AIDS Conference convened precisely where we're sitting now. And it was a terribly, terribly grim, horrible, depressing time. The meeting was filled with despair. We saw nothing but death and increased numbers of cases. No hope on the horizon, and many of us left Yokohama feeling that the great pandemic had overwhelmed humanity. A few years later, we had the Okinawa Summit, which Prime Minister Mori just told you about, in which 3 great resolutions were passed that HIV infections, new infections, should be cut by 25% by the year 2010, and that both prevalence and deaths due to tuberculosis and malaria should be cut by the same target date by 50%. Out of that grew the Global Fund to Fight AIDS, Tuberculosis, and Malaria. And with us, we have Dr. Mark Dybel, who's been through this whole trajectory from the grim days to the current days. He was a researcher at the National Institutes of Health and then helped design, create, and eventually ran the President's Emergency Plan for AIDS Relief, PEPFAR, in the United States, which is the largest donor for HIV, tuberculosis, and malaria in the world, and now relatively new to the job, he is running the Global Fund. So I want to start with you, Mark, and ask you, if you look at this trajectory from the last time the World AIDS community was in this room in 1994 to where we are today, and where we hope to go next, take us through that arc.
Thank you, Laura. It's a great privilege to be in this room because Japan has played such an important role. Yokohama, of course, but also Okinawa, as Prime Minister Mori-san talked about, the birthplace in the many ways of the Global Fund, which I'm very honored to be running. And now we have Mr. Abe-san, who will speak at the end, carrying on that tradition of Japanese leadership. So it's wonderful to be in Japan and to talk about these issues. The world has changed tremendously from Okinawa, and it really has been a mix of financial resources, but led by science and technology, led by epidemiology, and led by creativity and innovation on the ground. And it's really all of those things together that have led to the point where we heard His Excellency President Kikwete talk about where we are today. And while there have been many people supporting the countries such as Japan, also many others that are in the game financially and technically, the UK, Germany, France, the US, it's really been led by Africa in terms of the response in Africa. People like President Kikwete, but also people like Alex Coutinho, honored last night, on the ground. And as President Kikwete talked about, it's been a continuum from leadership at the top down to the communities that actually initially got the leaders to move. But because of that, we are at the point, and it was mentioned several times, turning point or tipping point, where we can say what we've never been able to say before. People throw around the word eradication. I want to be clear that we are not at the point of being able to eradicate HIV, tuberculosis, and malaria, but we are at the point, if we are smart, using the advances in technology linked to the epidemiology that's showing us where hot zones of new infections are, whether it's HIV, tuberculosis, and malaria, because of the advances of the last 10 years that have pushed infections into corners, by using the systems that have been built on the ground at national coverage, which we have never seen before for any other interventions, national coverage, we can, in fact, if we're smart, completely control HIV, tuberculosis, and malaria. And what that means is driving down from pandemic to low-level endemic levels. Now, why is that so important? That's a lot of epidemiological language, but what it means is forcing down to control so that you interrupt transmission so it's inefficient, so that transmission, which is highly efficient now, becomes inefficient. And what we know, whether it's malaria or tuberculosis or HIV, is that you can go within 5 miles in a country and have transmission rates go from an incidence of 5, 6, 7 to 0.1, 0.2. So if we can contain down to 0.1, 0.2 everywhere, we then have very inefficient transmission. And what that means is all we need probably is relatively inefficient vaccines, 50, 60%, to actually come close to achieving those E words, which we have to be very careful about. That's extraordinary. We couldn't have said that 2 years ago. We could not have said that 2 years ago. And that's the game to me for the next 10 years. Not pulling back, but actually realizing the full return on investment of the last 10 years of that technological advance, of the epidemiological gains, of the on-the-ground implementation, so that we can be at the point where these vaccines, when they become available, will do the work that they could do. The flip side of that, and this is we need to be very aware of, and President Kikwete talked about, is if we do not take the time and energy now and resource now to completely control, we know what will happen. And President Kikwete talked about that. We're seeing it in Uganda. We're seeing increases in incident rates despite high levels of antiretroviral coverage. That's because it's the most mature epidemic in Africa. It's not because of anything they're doing wrong necessarily. We're seeing the same thing in gay populations in the United States and in Amsterdam. That's what happens in mature epidemics, in HIV epidemics. Over time, creeps back up. We're seeing it with malaria, which I'm sure we'll hear more about, that if you let up just a little bit, they'll come back. But if we push real hard, we can get down to really low levels. Same with tuberculosis. We're seeing rates going up in Eastern Europe and parts of Asia and parts of Africa where we should be going down. So the challenge is really very simple. Do we take advantage of this historic opportunity, which has never existed before, or do we lose hold of this opportunity so that we will have to keep fighting these infections forever? Then a 50, 60% vaccine ain't gonna do it, and we have nothing that tells us we're gonna have a 90% vaccine. So will we be the generation that takes advantage of it, or will we be the generation that let go of the only time in history we've had the opportunity to do this? And I'll end just by saying, as Michelle Sidibe, my close friend from UNAIDS, always says, it's either pay now or pay forever, which I think is a pretty dramatic statement. But it's also, you know, whether we're gonna take advantage of this humanitarian opportunity. And I understand, and this was referred to, we are in tough economic times. And the natural tendency would be, let's wait for 5 years until our economies are better, our budgets are a little bit better. Infectious diseases don't follow budgetary cycles. They don't know what's happening with the world economy. They don't particularly care. 5 years is too late. And that's why the moment's now, and that's why despite these difficult times, we need to step up. And while we are in difficult financial constraints, we're still a very wealthy world. And we can do this. And with leadership from the African leaders, with leadership from Japan, with leadership from around the world, we can actually do that. And that's the challenge to us. And that, compared to Yokohama, is night and day. The challenge is in 5 years, will we be back to where we were at Yokohama, or will we be on the verge of celebrating what's possible to completely control and ultimately end these as public health threats?
Well, we have been here before. You say in terms of HIV, we're in an unprecedented moment. But in terms of malaria, there was a time when, in the 1960s, when we set out to eradicate, and both chloroquine worked everywhere as a drug, and DDT worked everywhere to control the mosquitoes. There was no resistance. There was euphoria. And I know that Dr. Fatoumata Nafatouare has been confronting this threat of malaria and alongside other infectious diseases in her home country as Minister of Health in Mali, and now running Roll Back Malaria. When you look at this question of turning point and what history tells you about human battles with those parasites and those mosquitoes, how do you see it, and how do you see getting to this 75% reduction target for the Millennium Development Goals just 2 years from now?
Well, thank you very much, Lori, and good morning, everyone. I'm really delighted to be with you here, colleagues and friends, just after a month that I visited Japan with Princess Astrid, again, to highlight the fact that we still have a long way to go. But thanking Japan for its great investment in these diseases and its continued effort, and also appreciating the launch of the Global Health Innovation and Technology Fund to continue supporting development and innovations for neglected tropical diseases. Looking at malaria, as you rightly said, yes, under eradication time, we had two powerful tools, chloroquine and DDT. And the world was hoping that we will be able to eradicate malaria everywhere. But it didn't happen for many reasons. Some countries were focus countries, but many African countries were left out of this program. Later on, when African leaders really pushed and said that malaria is still a huge problem for this continent, calling on the World Health Organization to do really its utmost to ensuring that the continent is getting rid of malaria, that led to the creation of Roll Back Malaria in 1998 to respond to African leaders, and being joined by other UN agencies, UNDP, UNICEF, and the World Bank. Today, we became a great partnership to continue supporting the fights in terms of ensuring that the right tools are available. And we can see today that we have tools that work effectively. Bed nets, 1 billion doses of new treatment that is called artemisinin combination therapy has been really delivered in the last decade. 500 million bed nets also have been delivered in the last decade. Improving coverage, as President Kikwete said. But yet, with that, we are not even halfway. You said it, Lori, 50 countries are on track to achieving the Millennium Development Goals, meaning reducing by 75% the incidence of malaria. Among these 50 countries, it's only 9 African countries that are on track. But these 50 countries represent only 3% of the burden. Again, it shows that the 17 countries bearing the 80% of malaria burden are still African countries. Among them, it's only India and Indonesia being outside the continent. 14 countries bearing 80% of the deaths, they are still in Africa. So this is where really, as Mark was alluding to, that the focus should be on where really the burden is and ensuring that we're bringing malaria burden lower to ensure that there is no transmission. Unless we reach that level, we can't talk about elimination, we can't talk about eradication. But the optimism is that the tools are working, and it's, we got this level of a decrease in the burden of the disease when we start having the Global Fund, which represented 65% of the resources required for malaria control. But in the last 2 years, it has gone down to 50% of the resources needed, meaning that really, we've done a great deal of the work, but it is not time for us to relax. We need to continue using the current tools while investing in the development of new tools to contain the development of a resistance to our best tools today, which are artemisinin-based combination therapies, the only class of drug, and also the insecticide that we're using to impregnate bed nets. So I will stop there, Lori. Thank you.
Thank you. Well, this throws it right to that diplomatic stage, because what the whole future of both fighting HIV and malaria rest on is continuing a sustained commitment. If we let up, we get resistant microbes, and then it's going to be all the harder to tackle them because the toolkit won't work. So Jan Beagle, ever since your days in New Zealand and then throughout the UN system, and then for many years as the Deputy Executive Director of UNAIDS program, you're a political animal. You're somebody who understands how we have to battle on the diplomatic front to sustain commitment. When you look down the road, we're approaching this 2015 target, and supposedly by 2015 we'd have universal access to antiretroviral therapy for people with HIV. We're not going to make it, let's be honest. So, and then the next target that most likely is going to be the UN agreed target is something very different, universal health coverage. So when you look at that from your position at UNAIDS, number one, how do you sustain momentum when we hit a snag and we don't reach a target in 2 years? And number two, how do you fit in this universal health coverage picture?
Well, good afternoon. I don't think we know yet what will be the new goals, the new targets, the new framework. Intergovernmental deliberations on this are just starting in New York. We've had huge amount of consultation at the national level and at the regional level. So now we're at the global level, and there'll be a political discussion that will go on this year and till the end of next year before we get a new framework. But I think that the major lesson that we have out of the AIDS response is that we need to have a holistic approach. I think that AIDS, of course, is so much more than a health issue. It's a development issue. It's a rights issue. And I think the major lesson that we have is that we've got to look at it in an integrated way and in a holistic way. So if that's the case, then it's very important that we take individual diseases, whether they be HIV or any other, out of silos and look at them from what we would say would be a people-centered approach. So put the individual in the center rather than the disease in the center. And perhaps if we look at these years of the AIDS response, which have been very successful years, I mean, we have raised this political momentum to the highest level. We have raised unheard of amount of resources. What could we say for the future? Well, one of the things is maintaining this incredible partnership, maintaining that highest political level of support, as the President said and others have said. We've got it at the General Assembly of the United Nations, at the Security Council, at the African Union, at the ASEAN. At whichever level you look at it, we've got to maintain it globally, regionally, and obviously, particularly nationally. And as the President said, we've got to maintain those partnerships at the national level. So not just governments, the private sector, the civil society, traditional leaders, the young people, the people living with HIV, all of the different groups. We have to maintain that partnership. I think we've also got to maintain the focus on vulnerable groups. This is just key. Women and girls, extremely vulnerable to all infectious diseases, but particularly HIV. Young people, very, very important, particularly as you get to mature epidemic and people forget, and young people haven't had that education that maybe older generations had. We've got to make sure young people are at the table at all stages. We've got to make sure that those groups that are often marginalized in societies, whether they be sex workers, drug users, migrants, prisoners, men who have sex with men, whichever group that may have difficulty in accessing services, we need to make sure that they are included. We need also to ensure that we target the resources to those areas that are going to have the greatest return on investment. So it's not just about a matter of having the resources, it's a matter about where we put them and ensuring that they're going to have the greatest impact. And I think there are a lot of very good examples we can see in countries that are doing that, and they are making the greatest headway. We've also got, as also the President said, to ensure that we strengthen the community level, because that's where the change is going to come from. And that's where we see the integration, and that's where we see the greatest return on investment if we can integrate those services, whether they be maternal and child health, whether they be with non-communicable diseases, whether they be with basic community strengthening. And then finally, I would say we've got to work on those legal environments, because we have punitive laws, we have environments that foster stigma and discrimination, and if we can't deal with stigma and discrimination, we're not going to be able to ensure that everyone who needs access to the services are going to be able to get them. So I would say that the lessons that have come out of the response to AIDS are that we need to move out of the silos, we need an integrated approach, and we need to move forward under whatever framework we have in a way that doesn't take the foot off the pedal, as others have said. We have to keep the momentum. Thank you.
Well, it's interesting the way you put it, because your response to my question was to say what needs to be done on the ground. But we're really talking about a roller coaster here in terms of the support from the outside to make the resources available so that what you're talking about can actually be executed. And boy, if there's anything that's been a roller coaster, it's been the hunt for a vaccine for HIV. Some of you have probably followed this struggle over the years. I well recall being at the press conference when former Health and Human Services Secretary Margaret Heckler in 1985 said, "We will have an AIDS vaccine within 2 years." Well, we're no closer, really, than we were when she made that statement. And the real struggle for Margie McGlynn, who comes to this problem from the pharmaceutical industry, from Merck Pharmaceuticals, to now be the CEO of the International AIDS Vaccine Initiative, is how do you sustain commitment, not only from governments to private, public sector research, but within the pharmaceutical industry, within the biotech industry, for a problem that intellectually, it's hard for me to think of one that's proven to be tougher than this one.
Well, thanks, Laurie. Thanks for reminding me how challenging our task is in front of us. But first, let me also say thank you to Japan and the organizers of this conference. And it's terrific to see the leadership that has been shown by Japan, both from a financial perspective as well as from a technological perspective. And coincidentally, we had a vaccine candidate just begin a phase 1 trial just in April, which is technology coming from Japan, a Sendai vector virus, and financial support coming from the Japanese government. So it's great to see that coming together. But you're right, Lori, this has been a roller coaster. I am not going to make a forecast of when an HIV vaccine will hit the market. I will give you a sense, though, of why it's important to continue the focus. And clearly, if we think about other infectious diseases, it can take 30 to 50 years, unfortunately, to develop a vaccine, and some have been going on longer than that and are still not developed. But if you imagine what would have happened if the world had decided back in the early 50s to stop working on a polio vaccine, that's what continues to drive my passion and my commitment to make sure that we do see this through the end. And as Mark very clearly stated, we have tools and technologies available today to stem the tide of new infections, to get existing infections under control, to increase the longevity and the quality of life. But to ever truly end this epidemic, we need a vaccine. And so we have that dialogue consistently with donors, and donors get it. Government donors, very sophisticated donors, Gates Foundation and other foundations that have been important, the NIH and other government agencies. And so no one argues about the importance of continuing to focus. The question is, how do we best get there? And you're absolutely right, Lori. We need the contributions of pharmaceutical companies, biotech companies. But I do see some very positive signs that tell us that we're getting those contributions and we are advancing. And I'll give you just a brief status of the field. So the furthest along program would be the RV144 vaccine candidate that was tested in Thailand, and it showed 30% efficacy. Well, you'd never want to go to market with a vaccine that was only 30% effective. On the other hand, that trial gave us some clues as to some things that the field could do to improve the efficacy, such as to add a booster dose, because within 12 months it looked to be more like 60% effective, but 2 years it went down to 30. To also add an adjuvant, to make some minor changes to other components of the vaccine. So that program is going back into efficacy trial, and there's actually a licensure trial that should start in South Africa by early 2016. So that could be the earliest possible advance. And they've set a bar for that program that it does have to hit that level that Mark described of at least 50%, but could possibly be even better. And there are 2 pharmaceutical companies involved in that program. Now, the funding is coming primarily from governments and the Gates Foundation. One of the things we need to do to get pharmaceutical companies more financially committed is to generate that proof of concept. We need to de-risk the programs, and that's how organizations such as IAVI are able to come into play, where we're able to take advantage of government funding, foundation funding, and we're able to support the early studies that are needed to get you to that proof of concept. And that's exactly where we are right now with another a very important program, which hopefully will lead to broadly neutralizing antibodies. And I won't get into the biology about how the virus mutates, but you can just assume that if an antibody is broadly neutralizing, it would work across a variety of the different forms of the virus out there. And so we've had some tremendous progress in the last 4 or 5 years. We've identified more than 25 of those broadly neutralizing antibodies that do occur naturally in infected patients, but not until a few years after infection. So now the focus is, can we design a vaccine that will elicit those antibodies? And there's actually a backup approach that would take the genes that would be expressed into those antibodies and inject them into a muscle so that the muscle cell becomes the factory. But I won't go further into the technology, but suffice it to say that there is very strong momentum in the field. Yes, there have been setbacks, including another trial a few weeks ago that was stopped because it wasn't showing efficacy. But you learn from those setbacks. You figure out how do we continue to advance the field forward. And if you ever start to lose that commitment, you think back to polio and you think back to the wards and the lung machines, et cetera. And you think back to comments that Mark and others have made that we have made tremendous strides, but from a humanitarian perspective, we need to bring this epidemic to an end, and we have to maintain the resolve and commitment to do so. Thank you.
Well, of course, while our focus is on HIV, TB, and malaria, the Okinawa Declaration and Prime Minister Mori's comments referred to infectious diseases in a more general sense. And there was an understanding in 2000 in Okinawa when the G8 convened that HIV had seemed to come out of nowhere in 1980, 81. Something else could come out of nowhere as well. And Dr. Shigeru Omi had, fought one infectious disease threat after another in the Pacific region. Tuberculosis, he was in charge of the WHO Pacific Regional Office when SARS emerged in 2003, just 10 years ago. And now here we are facing a new SARS-like virus, MERS, which stands for Middle Eastern Respiratory Syndrome, which appears to have emerged out of Saudi Arabia already in 7 countries. As of about 3 hours ago, it had sickened 51 people, killed 30 for a 58% mortality rate. And at the same time, we've been dealing with a new form of avian flu, H7N9, which is a constellation never previously seen to infect human beings before, and never previously seen to cause disease in humans. It was a classic bird virus. Birds only, birds got sick, birds spread it, end of story. And now it has emerged in China with a very high mortality rate, around 62%, and great concern that while it has receded because of warmer weather, it could come back to us in the fall. So Dr. Omi, when you look at the discussion we've had and what happened with Okinawa, the outcomes from that, the institutions that have been built to deal with TB, malaria, and HIV, are we better prepared today? Are we in better shape confronting MERS and H7 and 9 than we were, say, 10 years ago with SARS or 35, 40 years ago with the emergence of HIV?
Well, Lori, thank you very much for your relevant but very difficult question. Now, as you rightly said, I have been personally involved in the communicable disease control, including SARS and the TB, etc. Based by past experience, my observation, of course, SARS is the first international public health crisis that brought with it literally enormous the social, economic, of course, negative impact globally. And through this SARS experience, I think we learned many lessons, but I think here I can limit only 2. First one is that the need for the global solidarity and partnership, particularly in the fight against communicable disease and also in sharing the information in the international community. I think that's the first lesson that we learned from SARS. And the second lesson that we learned is the recognition that health should be an integral part of the socio-economic development. Now, question, Lori, you are asking me is whether we are doing better after SARS. I think yes for many cases, but no for some. Yes, you already refer to the H7N9, which appeared recently in one of the countries in this part of the world, China, we all know. China, we all know that 2003, especially first part of the outbreak of SARS in 2003, China's response was not necessarily what we expected. We all know that. But now, this year, I have to be fair. China's response is better than the 2003. So this is the one thing we can be proud of based upon their achievement. And second one is that in the previous centuries, the disease like communicable disease or any disease was perceived as some issue that will be dealt primarily by health sector. But in the Okinawa Summit, which which gave the birth to the establishment of the global funds, I think that the Okinawa Summit was, in my view, milestone in the sense that political leaders, not just health ministers, president, prime ministers, foreign affairs ministers came on board. This is then that kind of trend was reinforced after SARS. I think then third point, which we all be proud of, is that until recently, there's a bit of the dichotomy whether vertical program is better than horizontal program, disease-specific program is more effective than the health system strengthening approach. But now, because of the experience, I think there's already conclusion. We need both. Health system and disease-specific program should go hand in hand. So these are the achievements, and these are some progress that we made after the global funds, after SARS. Now, but it does mean that we are perfect. There are lots remains to be done. In the case of tuberculosis, as the previous speakers, particularly President of Tanzania mentioned, still problem. And especially in interesting story, this thing that deserves special attention is in Africa, unlike Asia, younger generations are more predominantly suffered from this tuberculosis, which has, of course, their impact on the socio-economic development. And of course, drug resistance is another issue that we have to face, and co-infection between the HIV and tuberculosis. And what is more now, non-communicable disease on the rise. And if you become diabetes, it will put you more prone to the development of tuberculosis. So these are the challenge that we have to tackle now. Now, from here, I just like to speak in Japanese. So would you please, because Aizawa Sensei and the other Aizawa Sensei ほか日本のリーダーがおられるので、ちょっと最後のは日本語で話したいと思いますけど、私はたまたまですね、この1週間前に、ワールドヘルスアセンブリというのは第66回のアセンブリがありまして、たまたま議長をさせていただきましたけど、そこで多くの、各国のヘルスミニスターとかいろんな人に会いましたけれども、日本のこのグローバルファンズ、TB、それからエイズ、マラリアもそうですけど、この日本のサポートに対して多くのミニスターが非常に感謝をしておりました。で、今先ほどのプレビアスピーカーも話しましたけど、今ここで日本がこのファンドを少しファイナンシャルに今きついということで、もし下げるとですね、非常に強いインパクトがあるので、相沢先生もおられるので、ぜひですね、日本がこれ非常に国際社会から感謝されているこの人的、技術的、資源的なサポートをこれからもぜひ続けていただきたいと思います。そういうことで私のプレゼンテーションを終わりました。
I have to let the translators catch up. Well, indeed, I think that the world does very much pay attention to what Japan does and donations made by Japan. And we only have about 3 minutes left, and I want to put a very tough question to Mark and Fatimata. And the question is this. When politicians, political leaders, approach a problem, they like for the problem to have a set of obvious targets, achievables. They like for the problem not to be changing before their eyes, but to, in fact, be on a predictable trajectory that can be addressed. But HIV, TB, malaria, these are living organisms. They're in natural environments. They are constantly altering, and they're constantly trying to outwit and adapt, evolve against what we throw their way. How do we sustain a kind of real, genuine political and economic support for these efforts when we can't really say to any political leader, this is precisely what malaria will look like in 10 years. This is exactly what HIV will look like in people in 10 years.
Well, I'll start and then I'll let Fatima to correct me. You know, one thing I've dealt with a lot of politicians for the last 15 years, and the one thing I've been most struck by is what most politicians want to do is achieve something. They actually go into office to serve. They don't go into office to fight political battles. They actually go in to serve. And while it's true you can't, it's preferable to have complete precision, they're pretty comfortable with imprecision as long as you know what you're talking about and as long as they have some confidence that you can achieve results and that you have an end game. And that's why I think we have a huge opportunity today, because we have an end game. To be honest, if we were coming back to say, we're going to do the same thing we've done for the last 10 years for 3 more years, we need a lot more money to do it, we couldn't do it. The change is the change in the science, the change in the epidemiology, the change in the on-the-ground experience of the last 10 years that tells us if we invest today, we can lead to complete control in a way that would then allow a vaccine that's relatively inefficient, that's relatively efficient to succeed. And when they hear that message today, they get very energized. What they also get energized about is the impact on human rights. Because the groups that's been talked about that are most affected are the most vulnerable, marginalized, sometimes criminalized. And the notion of fighting infectious diseases while expanding the human family, while promoting the human spirit, a lot of people go into politics for that kind of stuff. So when you combine those two together, we're getting remarkable responsiveness to that everywhere we go because of the opportunity, and that's why they go into office. And they can see what they can do today to make a huge difference for the next generation. So I don't think we give politicians enough credit. They actually, it's our responsibility to give them those messages in that type of way with the data which we have, rather than kind of the general, we just want to do big things. But I'm very confident in the opportunity. When you mix expansion of the human family with the opportunity to end, as public health threats, 3 plagues, 2 of which have been around for thousands of years, one in the modern day Black Plague, that's pretty attractive to a lot of policymakers.
Fatima.
Thank you, Lori. Your question reminds me of 3 things. First of all, the donors' fatigue, and we've been advocating for a long time for the same things, and you can see donors shifting from one cause to another cause. The second thing is, politician. I've been in that capacity. The reality is that when you came as a politician, you're looking into the quick fix. You wanted your name to be associated with some achievement. So you are more interested in seeing really where I can do something that is tangible enough and that could make impact and will say, I've contributed to that. The third thing for me is related to how we present things in such a way that it is stepwise, so that people for very, very complex diseases like malaria, where you have the environment, the vector, you have human being, really the 3 together all changing their behavior, and you are not able to invest in science and development in order to understand what is happening, it is difficult for you to say what will happen next. So the messaging is very important so that we present things in a way that people will understand that my contribution would be add on what others will be doing in order for us that in the next 10 years, in the next 2 decades, that might be what will happen. Yes, we've been challenged for vaccine development. We've been challenged for many other things. The tools we're using currently, are they the best tools? We say, no, they're not the best tools, but they are the most effective at hand today, and we continue looking forward to have greater tools. So it's all about the messaging and how do you ensure that people are thinking that it is longer-term investment and that it's not really all the times about quick fix. Thank you.
Thank you. And I ask the panel to remain. Awisawa-san.
ありがとうございました。それではここで相沢一郎議員に開会のご挨拶を、閉会のご挨拶をいただきたいと思います。
岐路に立つ世界の感染症対策ということで、今日は素晴らしいシンポジウムでありました。冒頭、世界の感染症対策に圧倒的な、また決定的な機会を作った、また与えた森元総理のご挨拶、そしてタンザニアの大統領からグローバルファンドをはじめ、ロールバックマラリアも、あるいはガビも、さまざまな団体が、またグループが、そういった方々に集まる多くの人々の善意が、アフリカを、また世界の途上国を大きく支え、変えてきた、そういった趣旨の素晴らしいご挨拶であったと思います。そのお話を受けて、専門家の立場で、またそれぞれの責任ある立場で、この感染症問題に向き合っている、また戦っておられる最前線の、いわば戦士ですよね、闘士でいらっしゃるそれぞれの皆様からアップトゥデートな、また少し将来を見たときにどういう態度と姿勢が必要であるか、的確なお話があったわけでございます。大勢の関心を持つ皆さんが今日こうしてこの会場に足を運んでいただいた。しかしここにいるのは限られた我々人数であります。いかにこのシンポジウムが意味のあるものであったか、また本当の意味で平和で繁栄をした世界のために必要な今日この1時間30分であったかということの記録をしっかり残し、記録を残すと同時に今日のこの場のすべてを世界にお互いが発信をする、そういう努力がおそらく残されているのだろうというふうに思います。大きく成果は上がってきた、また上がりつつある。しかしさらなる戦いが必要だ、そのことを改めて今日確認ができたというふうに思います。そしてやっぱり最後は政治家の判断、政治家の正しい認識と行動が必要だ。我々にとって激励ともまた若干のお叱りとも思えるようなご発言が皆様からございました。しっかりと受け止めたいと思います。私ももちろん政治家の一員でありますから、ちょっとだけざっくばらんなお話を申し上げたいというふうに思いますが、政治家っていうのはある意味で単純な動物かもしれません。政治家をどうやって動かすか、それは実行している、チャレンジしている物事が成果が上がっている、成果が必ず上がるんだ、こういう的確な説明を受ければ、それを受け止めた政治家は有権者に、また国民にそのことを一生懸命説明をする、説明をし説得する、能力といいますか技術というか、 それは政治家が一番持っているのかもしれません。したがって的確な情報をいただくということ、そのことの大切さを改めて今日パネラーの皆様から学ばせていただいたというふうに思います。日本の国民も日本の経済界もある意味で同様であります。例えば今アフリカにも注目が集まりつつある。日本は官民挙げてアフリカとの貿易を増やそう、アフリカへ投資をしよう。これから2、30年はアジアの時代が続くだろうけれども、30年以降の世界は間違いなくアフリカが世界の経済を牽引する、みんなそういう認識があるんですね。ですから今からもちろん本音を言えば中国に肩を並べられるように、中国に負けないように日本もアフリカにいろんな意味で関係を強化をしよう、そう考えているんです。しかしいくら貿易や投資を増やそうとしても、保険のことがあるいは衛生の問題が伴わなければ、やはり経済的メリットを手にすることはできない。そのことを正しく日本の経済界もまた日本の国民も、いやこれは日本だけではなくて世界中のビジネスがそのことを認識をしなくてはならんというふうに思います。そういう視点を大事にしながら、この感染症対策しっかりと臨んでまいりたいと思います。日本は財政的な制約の中でかつてアメリカよりも ODA のたくさんのバジェット予算の規模を持つ国でありましたけれども、ここのところの厳しい経済状況、さまざまなことを背景に、大変残念な数字に少しダウンをしてまいりました。しかし、財政構造の改革等々の努力の中で再び、2000年の沖縄サミットの精神原点に立ち戻る。そして良い意味で日本がリーダーシップを発揮をする中で、ポスト MDGs 2015年以降のこういった世界的グローバルな課題に世界がどう立ち向かうか、日本がどうそれに臨んでいくか、良い意味でリーダーシップを発揮をする我々日本に生まれ変わらなくてはならない政治家の一人として今日ここで強くそのことを学んだところであります。日本人に最も影響力を持つ月刊誌文藝春秋という雑誌がございますが、その雑誌の中で先々月号でビル・ゲイツ氏がソフトパワーの大切さを訴えたわけであります。そのソフトパワーの最も重要な柱はこのグローバルヘルス感染症の対策だ。日本にこそ最もふさわしいそれだけの人材、技術、経験、そういうものを持っているではないか、そういう文章を寄せていただいた。我々日本人を鼓舞していただいた、激励をしていただいた。尾身先生と同じ発言をされた。本当に感激をいたしたわけであります。少し政治家の悪い癖で、クロージングにしては長いスピーチになったかもしれません。いつもあなたは話が長いとうちの奥様にいつも怒られておりますけれども、今日は幸い家内がこの場所にいないから、少し悪い癖が出たかもしれません。お許しをいただきたいと思います。それでは今日の素晴らしいこの1時間40分のこの濃密な成果を世界に大いに発信をしていく、そのことをもう一度皆様と共に確認しつつご挨拶といたしたいと思います。これからも共に戦いを続けてまいりましょう。ありがとうございました。
ありがとうございました。相沢先生とパネリストの皆様に盛大な拍手をお願いいたします。ありがとうございました。どうぞご登壇ください。ありがとうございました。それではこれにて本日のハイレベルパネル終了させていただきます。皆様お忘れ物ないようにご退出ください。レシーバーは机の上に置いていただければと思います。どうもありがとうございました。